So welcome to lesson 2 of module 3 of the new patients on tap formula. And in this module, what we're going to discuss is the various types of pages, and we're going to go through each page in more detail, and we'll show you samples of how each page should be done generally. So the pages, remember from the last lesson, that we must have in our website were home page, about us page, contact us page, blog, very specific condition pages, a page for each particular condition. We want to have a testimonials page if you're allowed to have that, depending on where you are. We want to have a privacy page, which we need to have for Google and Facebook so that we can start using their ads. And we want to have a terms page, which is the terms that you'll use in your business for working with your patients. So let's get on with it. So in the home page, we're going to have a number of requirements. We're going to have a clear navigation bar so that your patients, your leads can see clearly what it is you want them to do. We want to have a clear call to action, including a book now and including a book online and including a call now. We want to have a more generic type lead magnet. Now, the reason for this is because what we're doing at the home page is we can't be specific about one particular condition. Unless, of course, you're just doing one condition. But if I look at my own website, which we'll go over in a moment, we are a podiatry clinic, so we would have it. The more generic one we would use would be foot pain. So we have a foot pain lead magnet. However, if you go to more specific conditions such as knee pain, heel pain, whatever it happens to be, those lead magnets are different. But on the home page, we want a more generic one. And you can put on more specific ones within it, which we have done. But overall, the more generic one tends to work best on your homepage. You want to have easy to find contact details. It's not that the contact details even have to be on your homepage, but it needs to be very easy to see, where do I find to contact these people? Too often people will go onto a website and what they'll find is they can't find the phone number. Or if they want to send an email, instead of being able to kind of find their email, they have to fill in a box. And they have no idea when it's coming back. So they want nice, clear directions on where they can find their contact details. And then the last thing we're looking for is we're going to go through now an example of an effective homepage. So let's do that straight away. Okay, so here we are in my clinic's homepage, and we can see across the top, first thing we have is we have a very clear navigation bar, and it shows you everything that the patient is going to need. We have our testimonials, our tips and advice. This is our blog, because who wants to read a blog? We call it tips and advice. And we have our contact us, and we have what we do or the conditions we treat. And very clearly here we have book online. So should they go through on the website and decide they want to book online, they can do so. At the top, we have a clear call to action of what it is we do and where we're based. And we'll go through copy in the next module in a lot more detail. And at the time of recording this, we are in the middle of the coronavirus, and what the software system we use allows us to do is to add these notices easily. Just below, you can see we have a call button, which is clickable. And remember that although I'm showing this on a desktop, 80 to 90% of my patients are looking at this on their mobile phone, so they want to be able to click that button straight away. We have a little video. Video is great on websites. And then we have our copy or our message, which will resonate with my ideal patient, which we did in module 1. Then below that, we have our more generic lead magnet, which is a foot pain. Because we're a podiatry clinic, it's a foot pain. So it depends on if you're a physio clinic and you're listening to this, and the most common thing you see is back pain. And that's what you want your ideal patient to come in for. If that's your more generic one, you may well start off with a generic back pain lead magnet as opposed to a more specific, say, sciatica type pain. And then very clear call to actions, fill in the report, get your lead magnet, click here, and so on. Okay, and we have our copy, which we'll go for, and then you see we have some testimonials inside in it, okay, because we're allowed to have our testimonials. And then below that, we have more specific lead magnets for each particular condition that we're trying to attract and that our ideal patient is interested in. And again, more opportunities here for our potential lead who isn't ready or doesn't want to download a report but isn't ready to book an appointment and wants to talk to somebody. So what we do is we give them another opportunity to start that connection with us, begin that relationship by filling in their details. And you can see one of our team will get back to them as soon as possible. Usually we do so within the hours. And lastly, we have our contact details, like I said here, very clear where we are on the map and so on. So that's essentially what you're looking for on your homepage requirement. Your homepage, the thing you do not want to do, any marketing you ever do, is you don't want to send people to your homepage. You want to send them to more specific pages. So if you have a page on plantar fasciitis, or you have a page on, or you have a page on, you're advertising for knee pain or back pain, it should be to a specific page, not to your homepage. Okay, so the next page we're going to talk about is our About Us page. And note, you can combine your About Us page and your Contact Us page together to reduce clutter on the navigation bar. And that's done quite commonly. So an introduction, what we want is an introduction on the owner of your practice or your practice manager, and we also want to explain your core values, your culture, which is going to be framed in a way that will resonate with your ideal patient. We want to have friendly details all about your team. So remember what we said earlier, your patients are not, or your leads are not interested particularly in your qualifications. Now, I'm not saying you don't mention them, but you want to talk a little bit more friendly, because people will buy from those they like and they know. So we want to be friendly in our details. You want to have less emphasis, like I said, on your qualifications and more about how your staff are real people and how they should get to know them. You should also make sure you include a lead magnet, perhaps a lead magnet to book online with me. So each particular member of staff could be demonstrated that these are normal people. They're interested in whatever X, Y, Z, and you can book online with me by clicking on a button. You want to try and share your core values, or what it is that your business is about, which again is all built about what would resonate with your ideal patient. So what we'll do now is we'll have a look at an example of an effective About Us page. So here we are back again at the homepage of my own website. And what we've done in my website is, rather than having a lot of clutter across the top, we have connected our contact us page and our About Us page. So what we do is we have Contact Us, because that's a primary thing people want. And when they come in here, if they scroll down a little bit, what it gives them some information about the practice manager, you can see here. And then what it does is it allows them to meet the rest of the team, which will bring them to our About Us page. Okay. And then they get to meet each individual member of staff, and you can see it talks about more normal things, less about their qualifications, because the patient is assuming they're qualified and is not interested in that. Simply wants to have something that they can resonate or find a connection with. So we talk, for example, here about this podiatrist, where she's from, what she's interested in, what she's been interested, what her passions are, and so on. And it gives them the option to book online. And we can see we do that all the way along. And other than that, then what we have is down the bottom, we have our core values, why they should choose us. And the core values, again, as you can see here, these are the values and the philosophy that we use in our clinic to help that patient to achieve their goals. And they're written from a perspective of what will resonate with our ideal patient. So again, once the patient decides, yes, I want to see this person or that person, they can click here and it will bring them to a book online page that we would have, as you can see. So the next page that we're looking for the Contact Us page. And the Contact Us page does not need to be too cluttered. It needs to give clear instructions on how to contact you, including your email, your phone numbers, etc. You're better off not having one of those boxes that they fill in and sends an email in, because the patient wants to be able to, if they need be, take down your email address and contact you on their own email. You could do both, obviously, if you need to. Your address and your Google Maps should be there with an ability to click on this. And this is very easily done. Google Maps will help you to do this, and you do not need to be particularly techy. You should have a book online options. You need to have clickable phone numbers like I've shown you earlier. And you need to have lead magnets, such as contact or speak to a patient, rather speak to a clinician. So in my case, speak to a podiatrist, and always an opportunity for that lead to take the next step. And you want to show them what you want them to do next. You want to give a clear call to action on a non-cluttered page, because if they've gone to the contact us page, they're at the point where they're nearly ready to make that next step. So you either want to say, click here to call me, click here to book online, fill in this form for us to get in contact with you, but at the same time, here's where we are, this is how you get directions, and so on. So let's have a look. Again, we'll go back now and look at the contact us page we looked at a moment ago. Okay, so here we are back in the contact us page, and you can see, because I have two clinics, we have both addresses. They're both very clear where exactly we are, and we also have these are clickable, so this will bring you straight to a Google map showing you where we are, and the phone numbers are clickable, so you can ring either clinic directly. It's very clear on when we're open and where we are, like I said, and we also then allow that person to book an appointment online should they need to, simply by inserting the code that comes from the CRM. In our case, we're using Clinico. And then, like I said, we have inside in it our About Us page with more for them to do if there needs be. And lastly, another lead magnet or call to action, which is have one of our team call them to discuss if they're not sure whether they need to make an appointment, or if they're ready to go ahead, if they're not ready to do the next step. So remember, when they go to the call to contact us page, what they're looking for is a non-cluttered page that gives them multiple opportunities to make contact with you, and it's clear what your options are. Okay, so now we're going to talk about your blog requirements. Then we will talk about how to write a blog and how you'll use blogs for your SEO in one of the future modules. But what we want to show you in this case is we want to talk about what actually should be on the blog page. So you want to make sure at the beginning that you are actually regularly updating it, because if you get a new website and you put in 3 or 4 blogs and you don't update them for a while, the patient will spot that you haven't updated your website for quite a while. I've seen it for years even, and it doesn't look particularly good. But by doing so, by updating your blog regularly, which we do talk about, like I said, later in another module, it will maximize or optimize your SEO and give you leads for free, pretty much. You want to make sure you have a call to action in every blog or on every page that you have your blog. You want to have a search option so that if over a number of weeks, now for example, I would have my clients write a blog at least once a week. So over 2 years, they'll have over 100 blogs. No patient is going to search through all of those blogs. They want to be able to have a search option where they can type in what they're looking for and get the information. If they see it, then they want to make sure that there is a call to action or a lead magnet on every page that we're basically asking them to do the next step. Now, like I said to you a little earlier on in this lesson, I would suggest you consider calling it your tips and advice page or something along those lines, because blog is not really something Joe Public wants to be reading. They don't want to be reading your blog because a blog sounds a little bit boring. But they certainly do want tips and they certainly do want advice, because if they've found your website, they're not ready to book that appointment. Perhaps if I go to this section that's all about tips and advice, then they're more likely to click on it and start to read. And when they read your blog or a number of your blogs, you'll start to build authority, and they're therefore more likely then to take the next step, which is to take one of your lead magnets or carry through on the call to action that you've asked them to do in the blog. So what we'll do now is we'll have a look at an example of a blog page and how you should try to construct it. Okay, so here we are back at the home page of my website, and what we're looking for, rather than a blog, is we're looking for tips and advice, because this is the sort of thing that they're going to be looking for. And we will essentially put in a new blog every 7 days over and over again. And what happens, you can see here, is we have a nice picture using SEO maximization in our picture as we do so. And here on the right hand side, we've got two of the things we told you must have. First is search, and the second then is a lead magnet. And that lead magnet will follow them around. We have a generic lead magnet, follow them around, because we could have up to 200 different topics within the blog. The software we use, and most softwares will allow you to do this, it just means it's very easy to do so. So if I show you an example, then this is obviously a blog, and then what you have to do is you have to click into the blog to read the rest of it. You'll see that we have more details on the blog. Okay, we have a call to action within the blog, and also we have a call to action within the blog, and also what we have put inside the blog is a further option. So the patient has come along, they have Googled whatever the condition is, they come across this tips and advice, they find what they're looking for, they read it, and then we've given them two options. Call us, and the number is clickable, so because they're on their mobile phone, or we've given them an option if they're not ready for that, they're frustrated and they're not sure who to speak to, they can put in their details and one of my team will call them and they will then convert them, which we dealt with in module 2. And we also have our lead magnet here on the right hand side and our search, all of which is necessary and is good practice when you're having a blog page. And remember, we will go through how to write a blog, how to use it for your SEO and so forth in one of the further modules as we go through this course. Okay, so now what we're going to go through is the conditions that you treat pages. And note that I said pages rather than one page, because each condition that you wish to attract from your ideal patient should have its own page, each condition. The page should not be about any other condition. And on that page, the lead magnet should be for this condition only. It should be specific to that condition. You should make sure that you use copy that will resonate with your ideal patient who's searching for help for this condition. And we will go through this in the next module, module 4, how to do that. We want to have clear call to actions so that we're using copy that is about this condition, directing that patient through to the point where we're suggesting them do X, Y, Z, download this lead magnet, book online or so forth, so that the page is simply about that issue and nothing else. And the idea will be that if that patient is Googling knee pain, ends up on a page, it should be about nothing but knee pain, and they find a solution to their knee pain on that page. So what we'll do now is we're going to have a look at an example of a specific condition page. Okay, so here we are back in my homepage, and what we have here is what we do, rather than conditions we treat. And it doesn't really matter I like to say what we do. And when I click on this, you can see, while we would treat a lot more than this, we don't have a big long list of all the things that we do, because it becomes too confusing. What do I pick? And a confused mind will make no decision. So we have decided what is the top, say, 6 or 7 issues that our ideal patient will come in with. And that's what we go after, because our marketing is also going after these. Our Google ads, our Facebook ads are about these. They're more so than about the profession. So if you're a physio, you won't really advertise that much about physiotherapy. You'll advertise more about the actual condition, knee pain, hip pain, because those people are more ready to go ahead with the treatment. So, and it's a better use of your marketing spend, and you'll have less wastage if you're attracting people who are closer to the point of making a decision, but not quite at that point. Because then your conditions page that you send them to, and you can double these up for using as landing pages for your advertising. The more specific they are, the more convincing you'll be than any other website, which is just more generic about what they do. So what we'll do is we'll pick here, for example, plantar fasciitis. So when we click on this, you'll see that this page is about nothing other than plantar fasciitis. Now, the headline across the top is about, are they looking for a solution to plantar fasciitis, and where we are. And we'll go through this in the copy section, like I said, but we come down as we scroll. So at the top, we can still have clickable phone number. They can book online. They can go back to the other pages if they need to. We have a welcome video from the owner of the clinic, and the copy is all about this condition. It's about their heel or plantar fasciitis. It isn't about anything else. And the lead magnet is about that particular condition. Again, plantar fasciitis. We haven't got a foot pain one in here. And so forth, all the way through. And this is what we call a long copy sales page. So long copy means there's lots of words. And the research will tell us that, especially when it comes to print, long copy will outsell short copy every time. The jury's out a little bit on online. Certainly on a website, I would always suggest slightly longer copy than you would do on an actual ad. So you can see all of this is about nothing other than the condition, plantar fasciitis, all the way through, so that patient can see that this condition This is the place that does nothing but this condition. Whereas I look at my competitors, it will be about 4 or 5 different conditions. And they're not entirely sure then, is this the place for me? Whereas my website, my landing page here is about nothing but that issue that they're looking for help for. And again, we have all the way along, we have call to actions. Tell us about your problem. Book now, and so forth. And you can see here, clickable phone numbers, clickable map, and so on and so forth. It's the same idea over and over again. So when you're doing a conditions you treat, the important part to remember is that the page should be about only that condition. You should offer a lead magnet that is about that condition only. That the copy should resonate with that ideal patient who's searching for help with only that condition. And you need to use clear call to actions that will get them into your marketing funnel using lead magnets of varying type. Now, you're probably at this point going, how am I going to write the copy? What will I say? Don't worry, copy is a big part of this. It's not as hard as you think, and we will do this comprehensively in Module 4. Okay, so if you're allowed to, a testimonials page is a massive bonus to have. And what we're looking for in testimonials is they allow you to build social proof. And social proof is basically your lead magnet, your ideal patient rather, being able to see other people like them that they can resonate with. So ideally, if your patient is a man between 30 and 40, ideally your testimonials should be similarly a man between 30 and 40. You will find in all cases that if you use video, it's superior to text because it's more believable, because there they are and you haven't made it up. Whereas if you type in someone, and you see this a lot on websites, they'll type in Jane 23 and then they'll say what Jane said. And it just has the appearance that they've made it up, whereas video, it can't be made up because there they are. You want to make sure that, again, you have a clear call to action, such as a book online, multiple different options when it comes to call to actions, and you want to have various lead magnets that you can offer. As you probably saw, I use testimonials throughout my website, and that's something you can continue to do. It doesn't just have to be in your testimonials page, but testimonials page or a page where you can see our successful clients, in of itself is absolute requirement. But don't be afraid to use those testimonials or reuse those testimonials throughout your marketing, not just on your website, but throughout your marketing. So what we'll do now is we'll have a look at our testimonials page. Okay, so here's our testimonials page. And remember now, the pages, it doesn't need to be too cluttered. And what we have here is we have sampled videos that when they can click on, they will see a video of that actual person talking about their issue. We also back that up then with further text, so you can do both, and then further videos below. And then lastly, we come down and they have a number of options when it comes to a call to action. They can talk to somebody, book online, they can inquire about a cost, and at the top then they can book online or call us through the contact us page. So what I would suggest you do is think about, once you know who your ideal patient is, when you have a patient that comes in that kind of fits that criteria and they're happy and they've thanked you for doing such a good job, ask them would they consider doing a short testimonial video. Take out your smartphone. It doesn't need to be anything professional. 30 seconds, 60 seconds, that's all you need. And put it up on your website, put it throughout your marketing, and it will build social proof that yes, this clinic, this site actually delivers what they say they deliver. So then what we're also going to be needing is we're going to be needing, remember, a privacy page. And this is a requirement if you want to use online ads. It's usually fairly standard text and there are guidelines available from Facebook and Google, and these guidelines do change. So every once in a while, every 6 or 12 months, it's best that you go and you search what are they looking for at that time. You also make sure that you have a terms of service page. It's very useful to refer back to if the patient needed to require a reminder of what you had said you were going to do it at the begin with. So what we'll do is we'll have a look at both of those pages now. They're not the most interesting, not supposed to be the most interesting. They're more a legal page that you must have or should have in the second case in your website. Okay, so here we are again back on my homepage, and where you will find the privacy page and the terms page is down in the footer, because that's not something you want to have really at the top of on your navigation bar. So down here is perfectly fine. And if we begin with the privacy page, we can see that it is not the most exciting of pages. It just basically is a legal document that you're going to put up on the site to just keep Google and keep Facebook ads, because you're going to need to use Facebook and Google. And should they change, you may need to use other social media, but they're all going to want to have these policies on the site. So that's privacy page. The second thing you're looking for then is terms of service page, or terms that this is what you, as a clinic, the terms that you agree to work with the patient. So you can see here, this is something we have. We have be on time, 24 hours cancellation notice, guarantee, etc., etc. And this is not really something that we would have to bring up or suggest the patient looks at in advance. But occasionally you may have a patient who comes back and said, I didn't know this is what was going to happen, blah, blah, blah. And we would refer them to the terms page and says, because in my clinic, we give them a copy of this when they arrive, a paper copy, and then we can send them on this and say, look, this is on our website, this was clear to you. It's just really a backup for yourself, and I think it's a great idea for you to have it on your site. So you can see it's not that complicated. You don't need that many pages. You're looking really just at a home page and a number of other small pages, about us page, contact us page. They can be separate, they can be together. You're going to have a blog, which you're going to regularly update. You're going to have condition-specific pages. That's the most important part of your site, that other than your homepage, is going to be condition-specific pages. Don't make the mistake that most websites do, clinic websites. They tend to have all of their website or all of their conditions bunched into one or two pages, and they may have one or two that when you click on it, you get a little bit of information on that condition. You want to have, if allowed, testimonials page so you can build social proof, and you want the more technical pages, which is the privacy page and the terms page. So if you have that, you have a very sound basis of a new patients on tap formula website. A website that when you send traffic to it, you send your potential leads to it, that they're going to find some reason to download or to take your lead magnet, which will enter them into your marketing funnel so you can follow up with them. And instead of getting maybe between 2 to 3, 4% of patients, or of website visitors rather, becoming a lead, you should be able to increase that to 5%, 7%, 10%. Depending on the page, you may get more. And that's it for lesson 2. What we'll do is we will see you in lesson 3, where we'll talk about all the other smaller things that you'll need for your website.